one of the things I wanted to talk about today was delay in care, and it's a little bit interesting in that you would think that that means that patients have an injury and they don't show up to the doctor until later. So maybe you get a cut and you kind of wait on it, or you slip and fall, or you slam your finger or something of that nature, and you just kind of wait to go into the doctor get it checked out. So that is one method by which that happens. But one of the things that I've noticed over the last few years, as you've had the increase in urgent care centers, people are getting treated in urgent cares and also ERs where they get an initial assessment and maybe they're told there's not too much going on, or maybe they get some stitches or something like that. And then they don't show up to our office until later when they realize down the road that there's a problem. And one example would be a small laceration on the hand. Say you're cutting an apple and you poke your finger. And so, as a hand surgeon, what I would look at immediately if someone disrupted their tendon, I would see from across the room that that tendon is out. And I can, see that, do a full exam. You shouldn't expect that the immediate care, even the emergency room, is necessarily going to do that because their job is to protect life and limb. So they're doing the most serious things. They want to make sure that you're not uh, going to have some life-threatening event occur. And once that's done, they refer you to a specialist. So whenever you have these injuries, you need to get follow-up uh, by a hand surgeon afterwards. When you get these little cuts and scrapes that are repaired in the ER, or even fractures, and even if they say, oh, that one's not too bad, there are a lot of those not too bad fractures that I wind up having to operate on down the line. So just consider after that visit to the urgent care, even if you've not been given follow up to a hand surgeon, make sure to make that appointment just to be on the safe side.